Mary Lanning's changed a lot, including the name from Mary Lanning Memorial Hospital to Mary Lanning Healthcare. The physical structure has changed immensely. When I started, the old hospital was still connected to the tower. When I started, the tower was only about 8 years old, so things were still very, very new. In fact, in the lab where I work, we still have cabinets that were put in when the tower was built. Not many of them left, but there is a few still left in place that hopefully we're going to change out soon. But so yeah, and the biggest part of it is just how it looked. I remember coming up those steps of the old hospital, coming into the hospital. You could come in through the front doors where the gift shop and Garden View Grill were, and then come up the stairs. Lab was on first floor, so we always came right through those doors and upstairs. Or we could come in through the old hospital entrance, which was very nostalgic in the fact that the steps you were walking up were worn. They weren't new, they were smoothed out. They'd been there for many, many years. The entrance inside was white marble, very, very impressive. So, it gave you a feeling of what it meant to be part of the Mary Lanning family at that point in time. I've been here for 50 years. So over that time, we've added the Cancer Center, the Medical Services Building, the addition to the Medical Services Building, the extension of the North Tower, helipad. We didn't have helicopters when I started. It was inside. When I started, there was no cardiopulmonary. Lab did EKGs, so we had an extension until respiratory therapy came in and then changed to cardiopulmonary. So how we looked was completely different than what it is today. And people that know and have seen the pictures of the old ones, all the old houses around that are now demolished and parking lots in their place. And so, but it's a matter of you move with the times. You have to modify what you do to meet what your needs are. Mary Lanning Healthcare was founded on a premise from the Lanning family in recognition of their daughter who happened to pass away from pneumonia back in the early 1900s. And as part of that was needing a healthcare facility that would prevent some of those things from happening. So it was founded in her memory, Mary.
What I know about the history of Mary Lanning Healthcare is that it was started by a mom and dad who had so much love for their daughter. My understanding is she was going to college and she came home for a little while. She fell really ill, and her mom and dad felt that if there was a hospital here in Adams County at the time, that she probably wouldn't have passed. And so they wanted to make sure that that didn't happen to the next daughter or son. So, since I've been here at Mary Lanning, I think that what makes us special is the passion and the drive behind every person, no matter how big or small their role might be. We're all here to take care of our patients and make sure that those of us in supporting roles such as mine, that the people who are on the front lines have all the tools and supplies necessary to be successful in their role. And so I think we all play a big part in that.
Mary Lanning's special because of the people who work here. I've met amazing, amazing people through those 50 years. A lot of them that I've met no longer around. A lot of them have moved on, a lot of them have passed away. But it was always the people that we work directly with and how we approach, what I would call community. It's a understanding and a respect for the person that you're working with whether you're in lab or whether you're in environmental services or up on the floors in nursing. It's all about the community that you're in, and that's why I'm still here. Hastings is another community that I fit very well in, and I've thought about leaving a couple of times and always came back to I don't think I want to be anywhere else. So it's been a great ride.